So, are you dealing with shoulder pain after a stroke? Well, you're not alone. Shoulder pain is one of the most common problems I see with my stroke patients, sometimes in the early stages after a stroke, but even more commonly, it's happening months and even years later. But here's the thing, while the stroke itself may be the reason your shoulder pain initially started, there are actually many other things that can cause or worsen shoulder pain after a stroke. And some of these things you may actually be doing without even realizing it can make your shoulder pain worse. So let's get into why shoulder pain happens and what you can do to help reduce or prevent pain altogether. So, why does shoulder pain sometimes happen after a stroke? One of the biggest reasons is shoulder weakness. We all know that after a stroke, it's very common for people to lose strength and control in the muscles that normally help stabilize the shoulder joint. The job of the muscles in the shoulder, when they're strong and healthy, is to hold everything together and create stability in your shoulder joint, which is what allows us to move our arms and do all the things we normally do with our upper body, right? And it's pretty incredible when you stop to think about it. The shoulder is really one of the most complex and mobile joints in the body. I mean, just think about it. Most of our other joints mostly bend and straighten. Maybe you can do a little rotation, right? But just think about all the different ways our shoulder can move. I mean, it does it all, but it also relies on a bunch of different muscles to keep everything aligned and moving correctly. I mean, you have muscles from the neck that attach at the shoulder, muscles from your back that attach at the shoulder, your chest, and the arm. I mean, I don't think it could be any more complex. Now, throw in a stroke. And unless you've had a stroke that doesn't affect your arms, that complicated balance of muscles that is the shoulder is now zapped. There's no active movement or very little movement. So, what does that do to your shoulder joint? Well, when those muscles that are supposed to provide that stability aren't working normally or the way they normally would, your shoulder is now vulnerable to pain and injury. Some of you may have heard the term shoulder subluxation. I know I've mentioned it a lot in some of my other videos, really any video where I talk about stretching and strengthening the arm. And for good reason, because having a sublux shoulder is not something you want to deal with if you can avoid it. Shoulder subluxation is basically when the head of your upper arm bone starts to separate from the shoulder joint. Now, not everyone with shoulder pain has a subluxation, but it can absolutely contribute to the pain and discomfort some of you may be feeling. Typically, your occupational therapist or physical therapist can confirm for sure whether you have a sublux shoulder, but you can try to test it out yourself by taking one or two fingers and feel along the outside of your shoulder and see if you can feel a gap or slight dip in the area where your arm bone meets the shoulder. And sometimes, because of the atrophy that can happen with shoulder weakness, you can sometimes actually see the separation in the shoulder. And if you think you see or feel a gap or space starting to form, place some support under your elbow and lift up slightly. Because with shoulder subluxation, when the arm is supported under the elbow, you can actually see the gap and separation close temporarily. And when you remove the support you were providing at the elbow, you'll see that gap or space reappear. So if you're seeing or feeling anything like what I just described, it's time to really start taking serious precautions to protect that shoulder and keep it supported at all times, okay? Another common cause of shoulder pain after stroke is just limited movement. If your arm isn't moving actively or passively with stretching, the shoulder can start to become really stiff. The muscle tissues actually will shorten because they get used to being in this immobilized position all the time. And over time, the joint capsule, the muscles, all the soft tissues around the shoulder can start to tighten. And trust me, once your shoulder gets stiff and tight, it can be extremely painful and really hard to regain that movement. Another possible cause of shoulder pain is muscle tone and spasticity. If you watch the video I did about tone and spasticity, you know that some muscles can become overly tight after a stroke. And when muscles around the shoulder, the chest, the arm, even the shoulder blade become tight, they can pull the arm into positions and that places stress on the joint, and then it limits your movement. None of that is fun, right? Another reason you can develop pain is because the shoulder simply just isn't moving correctly. Now, sometimes people get movement back in their arm, but they start using it like they're in a way we call it compensatory patterns, like you're hiking your shoulder or you're trying to reach and lift your arm, but you're not using the right muscles to do that. Um, and when you do that without having enough support from your shoulder blade, you're forcing yourself through painful ranges of movement. Over time, this can irritate structures inside the shoulder and create pain. And then there are the things that people sometimes do unintentionally that can make pain worse. And one of the biggest ones is any kind of pulling on your affected arm. Now, whatever you do, don't let anyone else pull on your arm. Please don't let your family, caregivers, or anyone else pull your arm like when you're trying to stand up or help you reposition, transfer, or walk. Your affected shoulder is already vulnerable. So any kind of pulling on it can create more stress and potentially worsen pain. Another common mistake, and this is one I really hate to see, and that is when you let your affected arm just kind of hang down unsupported. When the shoulder is already weak and then you go and allow gravity to pull your arm down, you're you're putting your shoulder at increased risk for what we talked about, subluxation and again, pain. So proper positioning and support is so important to protect your shoulder, especially early on in your recovery. All right. Another mistake is forcing yourself to push through significant pain. Now, some pain and discomfort can sometimes be normal, but pain is information. And if you're doing something that's like consistently causing you pain, sharp pain, then that's a signal to stop. That's like something's not right. You're trying to do something in a way where it's not working, it needs to be modified. All right. Another thing I see is when people are forcing their arm overhead, like they're just really super motivated and eager and just really want to get better quickly. But the problem with that is if the shoulder blade and the shoulder muscles aren't moving together correctly, repeatedly forcing your arm overhead can, make that shoulder more irritated. And then you're going to start having issues with pain. So, what can you do? Number one, focus on positioning. Use soft supports like bolster supports, wedges, folded blankets, pillows, whatever you can get your hands on to support your arm when you're sitting, to support your arm under that elbow when you're laying down. And if you're able to stand and walk, but still have a flaccid or weak shoulder, consider using a supported positioning sling like the Give More sling. Remember, good positioning can go a long way towards reducing stress on your shoulder. All right. Number two, keep your shoulder moving, but safely. Establish a consistent stretching range of motion routine for your arm and shoulder that keeps movements within a safe, comfortable range to help maintain your flexibility and reduce stiffness. Number three, make sure you address any issues with tone or spasticity if that's something you're experiencing. Positioning, weight bearing, stretching, medications, other interventions recommended by your therapist or medical team might be appropriate for you. Number four, always work on quality movement versus movement for movement's sake. Quality matters. Don't just focus on the end result of just getting that arm up. Focus on how the arm is moving. Slow, controlled movement using the correct muscles that are meant to do that movement is going to be so much more valuable to you than trying to force movement that your shoulder just isn't ready for. And lastly, number five, please get help if the pain you're experiencing is persistent, not going away and not getting any better. Shoulder pain after stroke is not something you should ever ignore because it may actually be a combination of several different factors we talked about that's going on all at the same time. But a therapist, your doctor or some other qualified provider may be able to help you identify the cause of your pain and then help you figure out, your best treatment approach. The good news is that most causes of shoulder pain can be improved once, the primary cause has been identified. And the earlier this happens, the better your outcome will be. So if you're currently experiencing shoulder pain since your stroke, or if you've dealt with shoulder pain in the past, please leave me a comment. Let me know what things, seem to make your pain worse and what things have helped. Okay? As always, guys, I hope this was helpful and I will see you next time. If you found this video helpful, don't forget to subscribe for more DIY videos to help you along the way in your stroke recovery. Struggling at home? Have a question? Leave me a comment. I'm here to help.